It's really important to understand the asymmetry of the smile. If you notice when Joel Embiid, he wasn't looking at the camera because it's uncomfortable. You don't blink, so material can get caught in the eye, and you actually can have visual changes if you don't lubricate the eye and protect the eye. Hello, my name is Dr. Ken Liebman. I'm a neurosurgeon, and one of my specialties is facial pain syndrome. I was asked to talk about a recent diagnosis that many of us are aware of with Joel Embiid called Bell's palsy. The reason I was asked to talk about that is because I specialize, or one of my specialties is facial pain syndrome. That is a different nerve. There are 12 nerves that innervate the face, and there are 12 on each side of the body. So 12 on the right side, or 12 on each side of the brain, 12 on the right side and 12 on the left side. Joel Embiid has what is called Bell's palsy, and that is the 7th cranial nerve, or the facial nerve. The function of the facial nerve is to bring movement to the face. It allows us to lift our eyebrows up and down, close our eyes, move our mouth symmetrically. And when someone has this injury or this problem, they can't lift their eyebrows up and down, they can't close their eyes, and they tend to drool, or there's asymmetry to the smile. It's important and it's concerning because one of the main problems, as I said, is the function of the nerve is to close the eyes when it gets irritated. So when you have dust or particles in the eye, or someone bops you in the eye, you blink, and that's a protective reflex to get to the foreign material out of your eye. And when you have this problem, Bell's palsy, you tend not to be able to blink. It's really important to understand the asymmetry of the smile. If you notice when Joel Embiid, he wasn't looking at the camera because it's uncomfortable. You don't blink, so material can get caught in the eye, and you actually can have visual changes if you don't lubricate the eye and protect the eye. Bell's palsy usually comes on rather suddenly, as I mentioned. It starts, and then usually within 48 hours, the full syndrome is developed. The vast majority of people do get resolution of the problem within weeks to 6 months, and that's usually the time frame for this problem. And then usually up to 80% of the people do get resolution of, or get strength back to the face. The nerve starts to function normally. The exact reason or the exact cause of Bell's palsy isn't really well known. They think it maybe is related to some type of viral problem, so post-viral, and it's some type of inflammation to the nerve itself. The nerve gets inflamed and doesn't function well. So the main goal is to make sure there is no underlying problem. So when someone has Bell's palsy, they should go to the ER to make sure, because, it's somewhat scary, but somebody can have stroke-like symptoms and it can be misconstrued as Bell's palsy, because one of the symptoms or signs of a stroke is facial paralysis or facial asymmetry. So it's important to be evaluated in the emergency room, and many times images or studies are done to make sure there is no underlying problem that we need to address. The people that are more prone to Bell's palsy, it tends to not occur before 15 years of age, and it lessens after 60. So between that age group is the peak period. And there is no sex correlation, males and females, and there is no propensity with other types of problems, except patients who are diabetic, hypertensive, morbidly obese, patients who are pregnant or immediately postpartum. They're the higher risks for Bell's palsy. The recovery for Bell's palsy is primarily, you often give patients medicine to help combat the inflammation in the nerve. So we give them steroids, prednisone. You give them medicine to help protect the eye, such as a lubricant. We have this material, it's called artificial tears, that you can put in during the day, and then a lubricant at night, and just kind of tape your eye closed at night. So the treatment is really just to, again, combat or help the inflammation and help protect the eye. And then, as I mentioned, the majority up to 80%, if not more, have improvement or resolution of their symptoms within weeks to 6 months after the onset of the problem. So I would expect with Joel Embiid, although I'm not his physician, for him to get significant improvement within weeks and then resolution of his symptoms by no more than 6 months after the onset of his symptoms. If you're interested to learn more about the brain, please check out additional videos on our YouTube channel.